Okay, you're welcome to the second part of subfertility. Okay, and if you have not listened to the first part, it's important you go and listen to it. This is complementary fertility, and then you'll hear what we have said there, and then by the time you listen to this, you'll be able to make sense out of it. Okay, thanks. Okay, so lifestyle and stress. Lifestyle and stress. You will agree with me that stress has increased in our society. It has multiplied in our generation. Stress has a very big contribution to the declining fertility in this generation. Lifestyle also, like smoking, abuse of caffeine, use of alcohol. The use of alcohol has been scientifically proven to reduce both potency and fertility. Use of alcohol has been scientifically proven to reduce both potency and fertility. Also obesity, increasing obesity everywhere. People are overweight everywhere. It decreases fertility both in the man and the woman. Many women who are obese are dealing with one form of hormonal imbalance or another. Also environmental pollution. Environmental pollution everywhere, pollution of our water, pollution of the air that we breathe in, generators everywhere, plants everywhere, car pollution, all kinds of things. These are contributing to reduction of fertility both in the man and the woman. Okay, so what is the prevalence of fertility in gynecology clinics? They found out that 1 out of every 5 persons who comes to the gynecology clinic is coming in because of infertility or subfertility. Okay, sorry, 60%, not 1, 60% in a gynecology clinic are coming in because of infertility. And then they found out that in the general population, at least 1 out of every 5 couples are dealing with infertility or another. All right. Now there is all still talking about causes. There are specific male factors and then specific female factors. All right. In getting pregnant, they found out that the problem in 30% of couples, the problem lies solely with the woman. In 30% couples who are dealing with subfertility, the challenge, let me call it challenge, lies solely with the woman. In another 30%, the challenge lies solely with the man. And in 25%, the challenge lies both with the man and the woman. Okay, both with the man and the woman, that's combined. And then there's a 10% that is unexplained. And unexplained there means not really unexplained, but it means that they are not able to find the problem. Because if there's a problem, then the problem is there. It's just that medical science or in the centers where these researches are done, they are not able to pinpoint what exactly is the problem. If the couple is not getting pregnant, then there's a problem somewhere. There's a problem somewhere. So that's the distribution, talk of prevalence. 30% challenge with men, 30% challenge with women, 25% challenge both with the man and the woman, and 10% unexplained. 10% unexplained. Now, for today, we'll just gloss over how it is done, and then because we're going to really spend time. Like I said, I'm going to be spending a lot of time. I don't know how long I'll give, but I'm going to spend a lot of time, more of the time this year, to talk about fertility and how to deal with it in a complementary manner. So let's just say some things about management. Let's say some things about management. Please do not forget, you need to subscribe, you need to turn on your notification link, and if you can send this video to any couples that are dealing with subfertility and infertility, you can send these videos to them so that they will know what's up. literally the idea behind these lectures, so that you will know what is and what could be done about it, and then you know what science, how far science has gone, and what are the options that are available. Listen to me. I'm a strong believer in God. With God, the Word of God says nothing is impossible. All things are possible. The God that gave the knowledge of science plus the power of God and the wisdom of God, I believe that things can turn around for you. All right, so very important. So how do we go about the management? How do we go about the management? Number one, to properly manage fertility, there has to be extensive history taking. Okay, extensive. If the physician, the attending physician or gynecologist has to take extensive history. Why is there need for extensive history? To rule out many things. Sometimes it may be the fact that the couple are not living together, they don't have adequate sex. Other times it's because they are not sleeping together at the right time. Okay. Other times, sometimes I've even met a couple where the man never ejaculates into the woman. Never. He ejaculates, but he ejaculates only when he has wet dreams. In his dreams, okay, and then some people have said spiritual attack and all that. It might not just be, but I met somebody like that. Okay, so all kinds of things. We'll talk about male factor sometime later in another edition. Okay, so we need extensive investigation, we call it clacking, history taking. Now, so the other thing is investigation. The woman will need to be investigated. Some people come and they are asking that they don't have money to do the test. If you do, I think if you are really interested in trying to deal with your fertility problem, you should at least be able to raise the money for the investigations. The reason is this: let me just use that phrase. But what I mean is that there are plenty. There are 1,001 things that may be causing infertility. If the couple is not well investigated, we'll just be groping in the dark. We'll be groping in the dark. You need extensive investigations. We need to know first of all whether the woman is even ovulating at all or not. And there are signs by which the woman can know she's ovulating. Round about the middle of your month, your breasts become heavy and tender. There's medicine calls it water weight gain. The woman begins to gain a bit of weight, but it's because of accumulation of water, not accumulation of fats. Okay, and then also a basal body temperature goes up a bit. The woman will be feeling a bit warm. These are signs that that woman may be ovulating. Now, there are some times when these signs are there and ovulation didn't really take place. Okay, but these are signs that the woman really is ovulating. Okay, another way to know it is any woman whose period is between 28 days and 32 days, 75% of the time, the possibility is that woman ovulates. Any woman whose ovulation cycle period is 75% to 28 days to 32 days, there's 75% chances that woman is ovulating. Now, okay, so those are the few ways by which we can just tell, but that does not preclude doing the investigations. The investigations need to be done. So what are the primary investigations that the doctor will place the couple on, both the man and the woman? Okay, for the woman, we'll do hormonal assay. We'll check for the third cycle day follicle stimulating hormone, FSH. Okay, in case the doctor is asking you to go and do it, you know why they are asking you to go and do it. Okay, we'll also check the 21-day luteinizing hormone. All right, we'll check it. We'll check the level of testosterone in the body. We'll check the thyroid stimulating hormone. Okay, and then we'll check prolactin, and then also the estrogen level. These are the hormones that needs to be done. Any doctor who really wants to do his work, he will ask you to do this, okay, because this can tell us, can go a long way in telling us where the issue is. Okay, they will also ask you to do a pelvic scan so that we'll see what is happening there. You'll be asked to do an HSG, hysterosalpingogram. Some women refuse to do this because it's painful, but it's better to go through the pain than to be groping in the dark. Do everything you would. If the tubes are blocked, that woman will not be able to get pregnant. I told you, when the eggs are released, the fingers of the tube pick it and then push it into the tube, and then it swings back like that to somewhere, if my body is the uterus, to somewhere around here, and that's where fertilization takes place. The sperm will come this way, the eggs will come this way, and it will meet here. That's where fertilization takes place. If the tubes are blocked, we'll just be wasting our time. It's important that we do the right things. Okay, so those are some of the investigations. If the man they start out doing seminal fluid analysis, SFA, and with microscopic ultra and sensitivity for the man, we want to check the man's sperm. Okay, we want to check the seminal fluid. Okay, and normal seminal fluid should be between 2 to 5 cc, 2 to 5 mils. If you are looking at it, 2 to 5 mils, and then it should be able to liquefy, that is turned into water, between 30 to 60 minutes. If after 60 minutes is that it has not turned into water, that it has not turned into liquid, after 2 hours that it has not turned into liquid, that's a problem. Okay, and then also the count, the sperm count. That what you are looking at is not the sperm, that's the seminal fluid. That's the fluid that conveys the sperm. The sperm are microscopic, you cannot see them, they are inside that liquid. Okay, inside that liquid, the sperm should be between anything above 15 million. In some people it is 70 million, in some it is even 100 million and all that. And then it's important to say this, for us to really know what is happening there, seminal fluid analysis has to be done at least 2 or 3 times. It's very important, because depending on the man's how long it took for the man, how do I say it now, depending on how long the man has abstained before you collect it, seminal fluid analysis can really be different. By the way, the man should abstain, not meet with his wife, at least 3 or 4 days before they collect that thing. They can collect it by using a condom that does not have spermicides inside it. Most condoms have spermicides, but there are some condoms that don't have spermicides. Okay, so they are mating, they are having sex, and then the man releases into the condom, and then it is poured there. Or if there's no infection, it can be collected by withdrawal. That's at the point of ejaculation. The man comes out of his wife and puts it in a sterile bottle, not just any bottle, a bottle that you have collected from the hospital, and then you put it there. Okay, so the count of cells inside it should be between 15 million and above. Okay, that's very important. The morphology is also important. How the sperm looks like, at least 40% of the sperm should be normal. Some people even say 4%, but I am of the school of thought that about 40% of the sperm should be normal morphology, normal appearance, normal anatomical appearance. A sperm looks like a tadpole, somewhat like a tadpole. You remember a tadpole? When we were little, we used to think that they are fishes. We see them inside gutter doing like this, and we say, come and see fish, come and see fish. Those are the zygotes or whatever of a toad or a frog. Okay, so a tadpole, big head and some tail. Okay, it is with that tail, as it is wriggling it, that it swims 3 days journey from where it is deposited in the vagina to the place where it meets with the egg and they fertilize. Now, so that sperm has to have normal morphology. If you see most sperms, they are only head. A sperm that is only head, that does not have tail, cannot swim, because it is with the swim that with the tail that it swims. That's very important. So the morphology should be about 40%, and then the motility, at least 50% of them should be mobile. They should be moving, and they should be moving well, not just moving anyhow. Okay, that's very important. So that's sperminal fluid analysis. If we go through this, and then there are also other things that should be paid attention to. The WBC, white blood cells inside that analysis should not be more than 1 million. If it is more than 1 million, then it means that the man is dealing with infection, and the meaning is that it will make that sperm very toxic. That more than 1 million white blood cells in a seminal fluid is toxic environment for the sperm. That's very important. At some other times, some doctors will even do what they call a test for anti-sperm. Okay, that's for the woman. All right, so all that very important. So if we check all these and it is abnormal one way or the other, then we also need to find out where it's coming from. Okay, so we need to do FSH for the man, we need to do LH for the man, we need to do testosterone check for the man, we also need to do prolactin check for the man, FSH, follicle stimulating hormone, luteinizing hormone, testosterone check, and prolactin check. Okay, because the sperm are formed in the testes, but they are formed from messages from the pituitary and the hypothalamus. There's a message that is sent to the pituitary and the hypothalamus from the pituitary gland and the hypothalamus, and it goes to the testes, and then that's why the testes releases testosterone. Okay, and then so sperm cells are formed. Or also, if there's a problem in the man's prostate, the man will, you remember we said that the seminal fluid should be between 2 to 5 mils. In some people, the volume of the liquid is even smaller. That will show whether it will mean that the man has some problem either in his prostate, because it is in the prostate that liquid is formed. If the man has problem in his prostate, there will be inadequate supply of the volume, and if the volume is inadequate, it may not be rich enough to fertilize the woman. So several things. And then some people, you say they should go and bring sperm, they can't even produce it. Okay, so there may be retrograde ejaculation, or maybe the prostate gland is infected or has been destroyed, or the testes have been destroyed. All these things need to check. There also needs to be a physical examination of the man's testes. There's what you call a varicocele, tortuous veins around along the bodies of the scrotum. It makes the testes, the scrotal sac, to be very hot, and that destroys testes. These are some of the things that will be done initially. Okay, as I close today, what are the things you should tell these persons, man and woman, up front? They should control their diet. Eating green leafy vegetables, okay, help a lot. They help fertility a lot. They help a lot. Okay, they help. Also, eating foods that are rich in fiber help a whole lot. Yam also helps in fertility. As a matter, thank you. I just remembered, I've been struggling with remembering the name. I just remembered now. There's a place called Igbono in western Nigeria. They found out that is the place with the highest number of twins in the world. the highest number of twins in the world. And they did a study and they found out that it's because somehow they eat, there are some specialized yam that they eat. So yam has a way of contributing to fertility. Okay, so what other things should people who are believing God for pregnancy not eat? Stay away from alcohol, stay away from caffeines and stimulants and drugs, stay away from them, stay away from sugary and sweet things, stay away, don't abuse oils and fats. Fats destroy fertility. Also wheat and flour foods, because it contains gluten, it also destroys fertility. Control stress. Make sure your stress is well controlled. So very important. Make sure your stress is well controlled. Part of eating, also eat fish. Fish helps. Fish oil helps helps fertility. Okay. So what are the supplements that any woman and man who are believing God for fertility, for pregnancy, should be on? Zinc, vitamin A, vitamin C, vitamin E. Okay, zinc, vitamin A, vitamin C, vitamin E. Folic acid. Folic acid helps cells that multiply speedily, and the sperm cells multiply speedily. Even when a woman gets pregnant, there's a lot of very fast multiplication if fertilization takes place. And so the man and the woman should be on folic acid. Ubiquin is coenzyme Q10, and then good multivitamin complex is important. Other things like L-arginine, membrane oil, grapeseed extract are also very important. Exercise is important for couples who are believing God for children. Some herbs that can help are ashwagandha, maca, bee pollen, bee propolis, dong quai, damiana, royal jelly. Very, very important. Very, very important. Other things to do are they need to control stress, they need to reduce stress, and then they need to control weight if it's important. Now, all these latter ones I'm talking to you about now are the complementary aspect to fertility. They are so very important. And then, of course, if we have done all this and it is not doing, they are not getting pregnant, we might need to up our game to use of IUI, intrauterine insemination. Intrauterine insemination is the physician collects the man's sperm and then spins it so that the sperms will be reduced from the seminal fluid, and then it will take that sperms, the sperms, and then just push it into the uterus. You remember we said they swim from the vagina up into the uterus and then to the upper part of the uterus. So what a doctor will do is take it and then just push it into the uterus, and then so that you have helped it cover some aspect of the journey, and then we'll believe God. IUI will work for some people. Then there's IVF. It's very important. Some people, when they hear IVF, they get skeptical. Some people have religious skepticism about it and all that. There's nothing to be skeptical about it. About 70 million so far. Is it 70 million or 7 million? I'll check it and get back to you. Babies throughout the world have 7 million, I think. From the first time in the early 1970 when it was done. Louise Brown, that's the name of the first IVF baby, and I think she's all grown now and married and all that. From that first time till now, about 7 million people have babies have been born via IVF. Okay, so it's expensive, but we work with some places where it can be affordable. We work with some places where it can be affordable, and we're working very hard and very seriously at establishing our own IVF center. It's so very, very important. Okay, so IVF is the in vitro fertilization. Okay, what they do is that they will take the eggs, stimulate the woman, take the egg, put it in and then take the sperm and put them in a dish of some sort in the same container, so that the sperm doesn't have to be swimming 3 days. The eggs are just next door to it, and then a sperm or two will fertilize some eggs. That's simple IVF. But there's even a higher one, and that's ICSI. ICSI is intracytoplasmic sperm intracytoplasmic sperm inoculation or something like that. In ICSI, they don't take the sperm and the eggs and just put it in one place. They will take the sperm, remove some things that is covering the egg's body, the egg's body, and then inject the sperm into the egg. In IVF, you bring them so very close. In IUI, you bring it this close. You bring them this close. In IVF, you bring them bone to bone, body to body, and then they can fertilize. In ICSI, you take it and you push it inside. And there are many centers where they do IVF, but they don't do ICSI in Nigeria. The center we are working on will do ICSI, and then we'll tell you very soon when it will be launched and when it will be started. Okay, so you see, I mean, by ICSI, you have removed a whole lot of the obstacles. Okay, and then we just believe God. I must say, fertilization is not the same thing as becoming pregnant. This is what I mean. So after it has been done like that, it is taken and it is inserted into the woman's body. Through some means, woman's body is prepared to receive the baby. But alas, sometimes it can fail. Okay, so fertilization rate can be like 75%, but getting it planted and turning into a pregnancy, it's not as high as 75%. Sometimes it's 25%, sometimes it's 40%. One of my teachers told me that in the UK, the pregnancy rate that's turning into pregnancy is just about 40%. But it's worth trying. It's worth trying, I'm telling you. Okay, the center we are working at we are really working at making it very affordable. Well, it will still be expensive, but it will be fairly more affordable than it is around here. And we believe God. We believe in the power of prayers. We believe in the power of spiritual warfare. By the time you combine all that, we believe in the power of herbs, of supplements. By the time you combine complementary fertility, spiritual fertility, and all that, we believe the result will be there. Okay, so I will stop so far. Please do not forget to subscribe. Do not forget to turn on your notification. Do not forget to send this URL to somebody who needs it. Maybe your children or your nieces or your nephews. You people have been praying for them. Okay, send to them and then let them call in. Let's begin to advise and to help and all that. Okay, people can get results. All right. We have our books, and Reversing Diabetes Naturally is available. You can order for it. Reversing Depression Naturally is also available. You can order for it. Sickness Free Fail-Proof Protocol for Regaining and Retaining Health is also available. And then one of my protegees' book, Living a Disease-Free Life by Daniel Ekele, is also available. Another protege of mine, Make Your Food Your Medicine. Okay, she's also the host of Make Your Food Your Medicine on Wazobia TV. It's also available. All right, that WAP TV. That's WAP TV. That's also available. Now, we are also on WAP TV Monday morning 8 o'clock. And then we are on Dove Television Monday evening 7 p.m. And then on this channel, Dr. Chris Williams on YouTube. It's there. We are also on Facebook. It's also there. Chris Williams on Facebook. You see it there. Okay, so you can meet us up on any of these platforms. Do not forget, God is so very interested in you, and you do not need to go at what you are go through it alone. you can have a companion that can be trusted and that can be relied on in God. Do not forget, we have not prescribed. We have not, this is not a prescription whatsoever, okay? We are just giving you information so that you know what is available, what options are available. If you have any, if you need to contact us, our WhatsApp number is there. And then all this, Dr. Chris Williams on YouTube, Chris Williams on Facebook, on the WAP TV, Wale Adenuga Productions TV, 8 a.m. Monday morning, Dope Television, 7 p.m. Monday evening. There are also other times that they repeat them in the course of the week. Thank you so much. Till I come your way again. Bye-bye.